Thank you very much for your time. So the World Health Organization recommending that governments temporarily pause preventative vaccines, including that for measles, as long as there's no active measles outbreak in the area. How feasible is this?
Well, it's certainly feasible to stop the campaigns. The concern is what the secondary consequences of that will be. By their very nature, these campaigns are designed to reach out into communities and bring vaccination to the children that are hardest to reach. So that's necessarily attempting to increase contact and interactions among folks. Of course, in this particular setting, there's a downside to that because of the potential to increase the spread of COVID-19.
Absolutely. I mean, the same organization saying that 140 people around the world died of measles in 2018, most being children under the age of 5. So can we really afford to halt these vaccinations?
Yeah, so it's 140,000 children estimated to have died last year from measles, and we anticipate that those numbers will be just as high this year, perhaps if not worse. There have been large numbers of resurgent outbreaks of measles, most notably in DR Congo and Central African Republic this year, some of the largest outbreaks of measles that we've had around the world. And these very often happen in countries that are the least well prepared to handle that potential surge in numbers of ill children. So this is absolutely something that we're very concerned about. This, again, like any situation like this is an opportunity to plan for these negative consequences, and if we can plan ahead, then at least we can coordinate efforts to try and rapidly improve vaccination and response plans as soon as the COVID-19 risk has passed.
Absolutely, and of course we must stress that these are merely recommendations from the World Health Organization. In South Africa, for example, it's mandatory that we do vaccinations. So this would mean big policy changes for countries who are just like us. Maybe let's talk about criteria or eligibility, especially for this vaccination. Who's eligible?
Well, all children are eligible. The recommended ages differ a little bit from country to country. Some countries, the recommended age for the first dose is 9 months, and in other countries, the recommended age for the first dose is 12 months. Those are, I would refer to individual country recommendations for that. But I want to be clear that the WHO guidelines at this point are not suggesting any change to routine immunization. So they're still encouraging parents to bring their children in for the normal well-child visits at either 9 months or 12 months for the routine first dose of measles or MMR, depending on the country that you're in. Right? What's being suggested now is a suspension of additional activities. These are these larger activities that bring measles vaccination out into the communities through outside of traditional healthcare establishments. Those are the ones that are being put on pause now. And so what that means is it's that much more important that parents comply with the normal recommendations to bring children in for their routine visits. In fact, if everybody complies with the routine vaccination, that's our goal worldwide. And if that happens, then actually these larger pulsed campaigns that reach out into the communities are less necessary.
Thank you very much to Associate Professor of Biology at the Center for Infectious Diseases Dynamics at Pennsylvania State University.